So four-way wrist is most useful when you're wanting to just increase range of motion within um, all the different wrist joints, or also to increase strength because these you're activating a lot of the different, all the main muscles of the wrist. So as you can watch in the video, you do all what how we're doing four-way wrist, which you can do in multiple different ways. You can either use a resistance band, you can use a dumbbell weight. There is a multitude of different things, but where you would do the four different directions of the wrist, which would be flexion, extension, ulnar deviation, and radial deviation. Right now, the patient is doing flexion. The past one was extension. Um, then this one is now ulnar deviation, which ulnar deviation you can do a lot of different ways. You could also just do it by holding the resistance band above your head and going down with the motion rather than having to twist around. And then this next one would be radial deviation as they go up with the resistance band down. You can tie the resistance band to a table, you can put your foot underneath it. There's multitude of different ways you can do that. The exercise prescription for this one is 3 by 12. Again, we want in the strength phase. Kind of depends on how high your resistance band is, but we are still wanting you to do a lot of the motion because your wrist is constantly in use. And so we really want to look on the endurance kind of strength. To progress this exercise, you can just do more reps. Again, that's a lot more endurance wise, or you can also increase the resistance band or get a higher dumbbell weight if you're using a dumbbell for this. You can regress the exercise by lowering the reps by doing 2 by 12, or you can lower the resistance band slash lower the weight for the dumbbell depending on how you're doing it. You want to discontinue this exercise if you have further injury to the wrist or these motions are not good, or even if you can't do all four different ways, you could do three of the ways. Say you have a ligament injury on the radial side, then maybe you shouldn't be doing that motion and or those motions. You can just do flexion extension because radial and ulnar deviation cause more pain within it. Again, it just that different injuries within the wrist, you can discontinue it. And you want to progress this exercise if you want to move to a more power functional phase and activities, as four-way wrist is not the most functional, but it does help a lot with strengthening, as you could see.